So let's take a few seconds here to review some of the burn stuff. So when we're talking about burns, there's 3 levels or degrees of burn. You have superficial, which is your sunburns just on that very superficial top layer of skin. They're red, they hurt, they're usually quick to healing. Then you have your partial thickness. And partial thickness has your white blisters. Usually it's going to have some fluid. Again, it's going to hurt because those nerve endings are damaged and burned, and so there's going to be a lot of pain. And then you have your full thickness. And full thickness, while it sounds like it should hurt, it does not. So there's usually no pain to this one. That doesn't mean that there won't be pain, because you don't just get a full thickness burn. When you get a burn, you get it's almost like a target. You get these areas. So in this middle area here would be your full thickness area, and then out here would be your partial, and then this part would be your superficial. So a burn is going to have look more like a target with different areas that are burned. How we get these burns is the 2 biggest factors are going to be time and temp. There's going to be a lot of other factors that go with it, but these are the 2 main ones. How long were you exposed, and at what degree of temperature were you exposed to? Another thing that we're going to talk about is the electrical burns. And electrical burns, what we have to remember is how they're different than other burns is that they have an area that they go in, and then they go through the body and have an exit. All right, the electricity has to move through the body. So this is going to be something that we really have to pay attention to. When we're talking about interventions that go with burns, is our main interventions we have to think about what does the skin do? So what does the skin do? The skin protects us from infection and foreign invaders, so it protects us. It helps us thermoregulate. So we're going to have some temperature issues that we're going to have to deal with. Other things that the skin does is it keeps fluid where it needs to be. And so we're going to see fluid shifts happening. So our interventions are going to all go off of these kinds of things. So protection. So we might need to put some sort of clean barrier on it, especially depending on at what stage of the burn that you're in. We may need to give a tetanus shot because burns tend to be dirty, and so we may have exposure to tetanus, and we may need to get a booster of that going. We may need to warm the person up. And again, part of that, putting a cover on them, will cause warming them up. What we don't want to do is we do not want to put any sort of oil on it, especially if it's a fresh burn. Do not put oil, do not put ice. Those are the 2 big no-nos that we do not want to do with our burns. Then we're talking about fluid. This is where that math calculation comes in. So if you haven't done it, make sure you look at that math calculation video because we want to give the right amount of fluid. Too little fluid is not going to benefit them, and too much fluid is not going to benefit them. If you put too much fluid in and you have an area that's burned, the fluid's just going right out of it. So the fluid's just coming out, and then we're swelling that tissue more. And then that tissue that was a partial thickness burn is now a full thickness burn because of the lack of vascularization to it. So you basically have caused so much swelling that now the blood flow can't get to it. So it's really important that we do fluid and we do it just right. So make sure you're looking at those math calculations and understanding how to do that. Now, when you get to a burn unit, they're going to use things like urine output to adjust the fluid. They're going to use things like the blood pressure and vital signs and all that stuff you may not have complete access to depending on where you are. If you're at a clinic or a nursing home, you may not have access to those types of tools and techniques. And so let's get them to where they need to be. So the other intervention is to step up their level of care, get them to the level of care they need to be. Now, that may be a simple burn. It may be somebody that was out on the boat and they may have a couple blisters on their shoulders, and otherwise they're fine, you know, have mainly superficial burn. They may not need to go to the hospital. They just may need some rest and some care for that. The other thing that we want to make sure that we're taking care of that I didn't have in here is pain management. Because our skin has a lot of our nerve endings, right? Our skin allows us to feel what's going on around us, and all those nerves then have been damaged. And so we're going to want to make sure that our interventions go along with those. What we want to talk about is some priorities. Priorities become very dependent on what's going on with your patient. So some of the priorities I want to know is, did they inhale? Did they inhale? I know it sounds like a joke, but did they inhale? Because that lets us know if the lungs are damaged, if the esophagus or the trachea's got some damage, and if any of that's got damage, then we probably need to get them intubated, because we need to be paying, our priorities are basically the same: safety, airway, breathing, circulation. We forget about safety, but safety really becomes important with our burns, or if they've gotten exposed to some sort of chemical, because there's some chemicals that if you put water on, now you've made that chemical even worse. So we have, they have to be like dusted off. So we have to be really, really careful what we're going to be looking at for safety stuff. It just depends on how they got burned. If they got burned in a house fire, then that safety, well, the firefighters hopefully took care of that part of it. So we want to know how they got burned or that tissue damage, and that will let us know what we have to do for our safety. If it's in our eyes, we need to get those flushed out, and you have to get really creative of how to get fluid just running through those eyes. Airway, that's that inhale. Did they inhale it? That airway breathing, how are they doing? Most of the times with our patients that have burns, they do not have any loss of consciousness unless they are to that degree of burn. But if they're a basic burn, they're not going to have any degree of loss of consciousness. So hopefully that airway breathing is fine. Circulation, we want to make sure they have a pulse, and we want to make sure they have a pulse to everything. If a burn gets down on, like, say this is an arm, and a burn gets around the arm, we have an issue, because that burn starts to constrict, just like any cooked tissue. It constricts down, and then you have lack of blood flow. The blood flow can't get past this area. So this area back here is all dying because blood flow can't get through there. So we're going to have to do some things called an escharotomy, where we go through and we cut that tissue, and it helps it open up. So that's why pulses become very, very important. Not to mention, think of this if this happened like on their chest cavity, if they fell into a vat of something and then burned their whole torso. You now have all that constricture happening around the chest cavity. So our priorities are a lot the same, as any emergency: safety, airway breathing, and circulation. So the same thing with our priorities as we've talked about with other emergencies. We need to recognize that something's happened, all right? Whether it's they spilled coffee in their lap, or they went out with their family on a day trip and we're out at the lake and are super burnt, whatever. We've got to recognize, we have to stabilize. So our elderly patients, they are gonna, just like elderly and babies, they are gonna have a harder time stabilizing with burns. Even a really large superficial burn can cause a lot of really big problems with them. And then we need to ship them. We need to get them to the level of care that they need to be in. If that's just going to the doctor and getting some burn cream or something special to go on, or some pain management stuff, that's fine. If it's getting them to a burn, getting them to the hospital so they can be evaluated, so if they need to go to the burn unit, they can, that's great too. It just really depends on what's going on with your patient, but really paying attention to recognize something's wrong. Don't just be like, oh, well, they spilled coffee, no problem. Coffee, ramen noodles, all those things cause huge, huge problems for people. So we need to really recognize that something has changed, or that an accident has happened. So if your CNA comes and tells you that something happened, maybe their bathwater was too hot when they got them put in the tub, whatever, we really need to pay attention to that and really go and assess it. We need to stabilize them. We need to look at, are they having a fluid shift? Is there enough of that skin breakdown that now we have issues with infection, thermoregulation, and pain? and we need to stabilize them as much as we can. If we can't do anything, we need to, keep them clean, do not put ice on them, and ship them to this. And the shipping can either be, like I said, it can be the doctor's office, maybe the wound center, or it could be 911. So it can be kind of anything. If you're working with a kid, maybe you had a kid, maybe you're a school nurse and you're working with a kid that got burned in chemistry lab, and because they were, screwing around with the Bunsen burner or something. And maybe your level of care is you got to call the parent and have them make some judgment of where they want them sent, or if they want them sent, or if they want to come look at it. It's just, there's all sorts of burns out there. And so this is just a really small snippet of it, but just kind of pay attention that burns has the same thing as any emergency. We got to recognize it first. We got to stabilize what we can, and we got to ship them or get them to the level of care that they need to be. Maybe they don't need extension level of care, but we always have to pay attention to that and always have that in our head of what's my next step, where do I need to get them.